We are having a terrible problem in the United States, and just about every country is, but the US especially, with the cost of medical care and healthcare services. And most of the reason that we spend so much on healthcare has to do with not the medical care system itself, but social and environmental factors that make people sick in the first place.
The Kresge Foundation cares about housing because we care about all the factors that affect health. And because people spend most of their lives actually inside buildings and most of that inside homes, we want to make sure that they're healthy, meaning that they don't harm people's health while they're there, or that they can even promote health in positive ways. We had a very competitive process of looking at sites all over the country that had significant amounts of federal funding to do healthy housing. And we selected those places that we thought were the most ready to choose some work that really would advance the field of healthy housing.
One of the things that these grantees are doing is to try and work with families to teach them about how they need to make their houses healthier. And I think it's very important work because it really impacts the degree to which children can be healthy. But for example, if you take a child with asthma, in many instances that child is in an environment that doesn't help that asthma. In fact, it really exacerbates the asthma. And we know, for example, that having children go to the emergency room costs about $1,000. To have children have to be hospitalized for asthma problems is probably $6,000 or $7,000. And yet there's much we can do about changing the environment of the house and teaching parents how to really look at minimizing those triggers in the house that affect asthma for children. There's no way, once a child is lead poisoned, to change that. And so society has to invest in these children in terms of special education. In many instances, they lose IQ points, they don't do well in school, and in many instances, in terms of juvenile delinquents, we know, for example, that in many instances, a significant number of those children have been lead poisoned.
It's not very efficient to only address one housing issue. We need to address them all. I think as a community we came together around the concept of looking for other housing health hazards and fixing them because we know how to fix them. Everybody knows that if your house is dark, damp, and dirty, you're going to be depressed, you're not going to be able to breathe very well, the paint's going to fall off the walls. We already know this, and putting this into place is a necessary thing.
We think with the Kresge funding, a policy approach will allow us to go to scale and have the most impact.
Our interest in the Healthy Homes Initiative is to impact the housing in South Los Angeles, much of it slum housing, which are making our children and families sick.
The Kresge Grant is an enormous opportunity for us to take work that we started more than 15 years ago and to begin to continue that kind of work with an academic rigor that I feel that we need.
The funding from the Kresge Foundation is critical to our organization as a relatively new group. It's really helping to vet the work that we're doing and prove to the community that we are a worthwhile cause.
We've been able to add wonderful new team members.
And that's been nice in the Kresge dollars so we can be creative.
Our overall goal is really to see these types of programs which educate both parents and the community and solve some of these problems be programs that become part of the fabric of a community.
There are a lot of people who are needlessly living in homes which are harmful to their health.
Every American should care about that our children have a right to healthy housing.
Everything is affected by housing conditions.
We are really jeopardizing the future of our country, the future of these kids, and their ability to grow and learn in these homes.
I think there's increasing understanding of the role of housing as a contributory factor to health, but many more people need to understand what they can do and what needs to be done in order to make them have a healthy environment.
What I would want to tell other health systems and the professionals in our hospitals, our physicians, our nurses, and others about healthy homes is the opportunity that presents for all of us.
If everybody doesn't buy into it, it's not going to work. It's like they say, yeah, you need a village to raise a child. Well, that's certainly where we are. Everybody has to buy into it.